Hello viewers and good evening. Welcome to Science TV 7 p.m. news with me Elvis Odhiambo and my sign language interpreter doing the voicing Irene Tribute. Caregivers of children with autism and cerebral palsy in Kericho have undergone special training to enhance their ability to care for children with developmental and physical challenges. The program equips them with essential skills including basic nursing, first aid, emotional support, and strategies for managing education at home. It is spearheaded by a rising community-based organization in partnership with BethanyKids. Kericho County Commissioner Gilbert Kiti encouraged parents to come forward with children living with disabilities so they can access support services available through government and partner initiatives.
Kuchunga wale wenzetu wako na ulemavu na mambo mengine. Na kitu ambayo inatufurahisha hapa ni kwamba hawa caregivers wana operate kutoka nyumbani. Wanafanyia hiyo caregiving environment ya nyumbani. Si kwamba wamewekwa katika sehemu moja.
Katika gatuzi la Kericho tayari tuko katika mstari wa mbele kuhakikisha ya kuwa wale ambao wako na disability wanatengewa nafasi zao. Pili, katika ile assessment kupitia kwa shule tunafanya ili tuweze kujua hawa watoto wanaweza pelekwa wapi, wanaweza kusaidika vipi. Pale hospitalini pia, mahospitali zetu zote za Kericho, the level 4 and level 5 hospital zinaweza kufanya assessments, medical assessments. Na tuko tayari, we have an able team and we fast track their movement whenever they come to the hospital so that they can be taken care of.
Caregivers wamekuja kutoka sehemu mbalimbali hapa Kericho, wamejumuika nasi na pia tumeweza kupata marafiki zetu ambao partners ambao wamepartner nasi sana sana Ministry of Health wamejumuika nasi na tumeweza pia kupata county commissioner amejumuika nasi na ameweza kukaa nasi tukasemezana naye na pamoja na caregivers. So siku hii ni hafla muhimu sana kwa caregiver ambao wamekuwa na changamoto kulea watoto wao. Sasa unapolea mtoto mlemavu mara nyingi maisha yako huwa sio rahisi sana, unahitaji kuja pamoja ili ujumuike na watu wengine ili kwamba maisha yako pia iweze kuwa rahisi kidogo sababu.
The family of missing activist Mwabili Mugodi has been turned away at Kilimani police station according to his lawyer Njanja Maina. Maina reports that officers at the station said the case was outside their jurisdiction, with the Directorate of Criminal Investigations, DCI, declined to take it up. Mwabili, a vocal critic of the government, has been missing for days after his alleged abduction in Dar es Salaam. His disappearance continues to raise alarm among rights groups in the region. Moving on, Nyamira Senator Okongo Omogeni has strongly criticized the Kenya Kwanza administration over what he termed as deliberate sabotage of the education sector through underfunding. Speaking during a funeral service in Nyamira County, the senator accused President William Ruto's government of betraying the public by failing to uphold its promises on education support. Omogeni specifically took issue with the government's decision to slash capitation funds from 22,000 shillings to 16,000 per learner, calling it a reckless move that would hurt thousands of students and struggling parents across the country. He warned that the decision will deepen inequality and deny many bright but needy students access to quality education. Omogeni urged the government to reconsider its stance, saying education remains a critical pillar for national development.
Ndiye amekuja leo amesema anapunguza hiyo pesa kutoka 22,000 kuja shilingi 16,000. Huyu anajali masomo ya watoto wetu? Anajali watoto wetu kweli? Ukisikia wananchi wanasema kwamba wewe utafanya one term, sio kwa sababu wanachukia sura yako, ni kwa sababu wanauchukia sera zako.
Next news. Doctors in Laikipia have issued a 21-day strike notice warning of a looming health crisis in public hospitals beginning August 15th. The move could paralyze medical services across the county. The Kenya Medical Practitioners, Pharmacists and Dentists Union, KMPDU, accuses the county government of neglecting long-standing grievances. They allege persistent, poor treatment of doctors, some of whom are working as casuals under major pay. Other issues raised, including delayed promotions, some pending for over a decade, denial of study leave, and failure to remit statutory deductions, which has locked many out of loan access.
County, we have doctors working as casuals. People have gone to school for more than 6 years to 10 years, still working as casuals, being paid on 3 months basis for their renewal of the contract. So as per our CBA, this is not in line with our CBA agreement that Laikipia County is part of. We also have doctors that have delayed promotions that are lasting for more than 10 years, and the county expects them to work as consultants.
We as a union are standing here boldly saying that our members will not continue to be disgruntled and be demotivated by the inaction and irresponsibility of Laikipia County.
Hundreds of residents in Mukurweini, Nyeri County, have received free medical services in a health outreach organized in partnership with Aga Khan University Hospital. The camp, led by Professor Teresa Mutahi, primarily focused on treating chronic illnesses among the elderly, including diabetes, hypertension, arthritis, and respiratory conditions. The medical initiative was held at the invitation of the local Catholic Church, has already attended to at least 560 patients. Medical personnel offered consultations, screenings, and treatment for various ailments, aiming to improve access to essential healthcare services in the area. Residents welcomed the outreach, highlighting a long-standing challenge of limited access to nearby health facilities. Many admitted to relying on over-the-counter medications or self-treatment due to high cost or distance of formal medical care.
We are very grateful because the community is assisted in a way that those who are not able to afford at a particular time, they can get drugs so that they can push them for the few days that they will stay. So we are very grateful for what Professor is doing to the community, and we thank God for it. In our health center, Kaheti Health Center, we have a health center that serves the community every day, and 75% of the people that we serve are mostly the elderly people who have chronic diseases. We have a small inpatient that we want to grow so that people can start benefiting from it from now.
And
What we have seen is non-communicable diseases. This is hypertension, diabetes, and we have realized that also arthritis is there. What we have realized is that many people are claiming to be far from medical facilities, and therefore they are refilling their drugs by buying over the counter or even self-medication, and many of them are not using the drugs. But what we are advising them is that even if you are far from the medical center, please do look for a medical professional, either a nurse, either a doctor, or a clinical officer. Don't treat yourself. Don't buy drugs over the counter because you cannot treat yourself.
Sasa sisi tumekuja kwa matibabu ya bure ambaye litangazwa na Profesa Teresa Mutahi. Na juu matibabu siku hizi iko na gharama kubwa sana, na hii imekuwa ni ya bure. Tumejitokeza tukiwa watu wengi sana, tumefika kama watu 1000, na saa hii tayari watu kama 563 wametibiwa. Na tunaanza hapa, anaanza na kupima watu kilo, pressure, alafu wamekuja na dawa za matibabu.
And we are very happy today to receive treatment and health support from Aga Khan University Hospital. We've been having challenges. We don't have good access to healthcare in this area. Many people have to go very far to be able to access healthcare. And one of the problems that we've been seeing is self-medication. They will go to the chemist and they get the medication before they are seen. Also, the community has also gotten elderly, and because of access, they have to go very far. So we are happy that they were able to come.
That's all we had prepared for you, our viewers here at Science TV. Thank you for joining me, Elvis Odhiambo, and my sign language interpreter doing the voicing, Irene Chebiwot. Have a nice evening and good night.